A meta-analysis, which is a review of several different studies regarding the serum or blood levels of omega-3 essential fatty acids and the risk of developing prostate cancer, was reported in the May and June 2013 Canadian Urological Association Journal. They concluded that those individuals who had the highest levels of DPA had the lowest risk of developing prostate cancer. However, those who had the highest levels of EPA and DHA had an increased risk of developing high-grade prostate cancer. This review obviously received a lot of media attention and has created great confusion among those individuals who are taking fish oil supplements because of their known health benefit in reducing cardiovascular disease and inflammatory diseases. Whenever we see a negative study like this, it is important to look at the details of the study to determine how they came up with this conclusion. First of all, it is very important to realize that this is not a new study. It is simply a review of the medical literature and all previous studies that looked at omega-3 essential fatty acids and the risk of developing prostate cancer. Two researchers basically just went through PubMed and pulled up all the research articles in this regard. The problem begins when criteria are used to determine which studies should be used in their analysis and which ones should not be used. It is critical to understand that none of these studies they eliminated or included in the meta-analysis showed any significant increased risk of high-grade prostate cancer in those with the highest levels of DHA or EPA. It is important to realize it was only when they were able to eliminate most of the studies and only include the studies they determined were relevant that they were able to come to their conclusion. However, even with all this manipulation, they had to still eliminate a major study that they had originally included to arrive at a positive association of high levels of DHA and EPA and the risk of high-grade prostate cancer. The Physicians' Health Study showed that this group had higher levels of DHA and EPA. However, the results of this study could not be trusted because these participants had an increase in awareness towards health practices. When this study was excluded, a significant positive association was noted on fish oil consumption, that's EPA and DHA, with high-grade prostate cancer. This is just another example of statistical manipulation. It is not a new study. They simply cherry-picked the previous studies that showed no risk to arrive at the conclusion they desired. Anyone who has ever been involved in statistics knows you can arrive at any conclusion by just determining the studies you're going to include or not include. When they still could not get the result they desired, they still had to eliminate a major study that actually showed health benefits of taking fish oil supplements by stating these people were just too health conscious to be included in their meta-analysis. There's also an irony in the conclusion that these researchers made by the fact that they recommend that you should just eat fish and not take fish oil supplements. This is amazing when you consider that they only looked at blood levels of omega-3 essential fatty acids. They did not really look at whether the participants had high levels because they ate a lot of fish or because they took fish oil supplements. Now, if they really felt and concluded that DHA and EPA increased your risk of high-grade prostate cancer, they should have recommended avoiding eating fish altogether, as well as not taking fish oil supplements. This is the problem with research today. What and whom are you going to believe? Well, the overwhelming majority of clinical trials show the health benefits of consuming high-quality fish oil supplements. However, the key is high quality. Fish and fish oil supplements are known to be contaminated with heavy metals that can be detrimental to your health. This is why Ariix has chosen to only use the highest quality fish oil that uses sources of DHA and EPA from smaller fish that have significantly fewer toxins. They also have their contaminants removed through a natural process. Now, don't sell your health to the lowest bidder.